taken heart meds. But what do you know about heart failure? It's a little different from the way it sounds. In fact, it's something that you can live with. And Sonja Brune is a heart failure practitioner with Baptist Health System, and she's got some key facts to share with us today. Good afternoon, Sonja.
Good afternoon, Fiona. Thank you for having me here to talk with you about heart failure.
Of course. Now, I would think that there's misconceptions about heart failure, so tell us what those are.
Well, heart failure is a lifelong condition that affects over 6.5 million Americans today. And while that term sounds very scary, we think of failure as basically something that either means that it's going to stop abruptly or cease to exist. Really, in the terms that we use, it describes a condition where the heart muscle can't pump enough blood to meet the needs of the body. So basically, the heart just can't keep up with the workload.
So what are the symptoms to look out for?
There's a variety of symptoms, but the most common ones include shortness of breath, cough, inability to lie flat, chest pressure, fluid retention, tiredness, fatigue, decreased appetite, increased heart rate or a feeling of fluttering in your chest, lightheadedness, and even confusion. And because these symptoms can be associated with other medical conditions, there's occasions when the heart failure is not even diagnosed initially.
Wow, so how long can someone live with, a heart failure? It would be based on what symptoms they're having, right?
Not only the symptoms, but also the cause. And so there isn't really a straightforward answer to your question, because there's just so many factors that affect the patient's survival rate, including age, gender, exercise tolerance, or what their symptoms are with activity, as well as other medical conditions. If a patient has a massive heart attack and there is a great deal of heart muscle damage irreversibly, that person will not likely live as long as someone who had heart failure caused by a valve problem that was repaired without any complications.
Okay, so you've touched on how some patients can live with this condition. Can you recover from heart failure?
So because it is a chronic health condition, usually there's no cure with heart failure. However, taking heart failure medications exactly as prescribed, as well as following the recommended lifestyle changes that we recommend for you, it can result in significant improvement in heart function. And sometimes the heart function can return to normal with normal heart size with the right combination of taking these medications.
All right, and Sonja, real quickly before we go, because we are out of time, you have a giveaway, right?
Yes, we do have a giveaway, and there should be a link for you to see on the screen, but we would love you to sign up for a chance to win a tablet and also download a Heart Healthy snack booklet from our system.
All right, Sonja, thank you so much for your time and all that information. To learn more about cardiovascular services at Baptist Health System, just call the number that you see on your screen, 833-229-3397, or visit the website baptisthealthsystem.com/cardiocare.